My name is Jessica Waljasper, and my topic is parosmia.
Parosmia is a condition causing food and other things to smell and taste like garbage, chemicals, burning, rotten meat, ammonia, and other repulsive things. It is still quite a bit of a mystery to doctors and scientists. This disorder is a debilitating disease that causes familiar tastes and smells to become unrecognizable. Parosmia can be caused by multiple different things such as seizures, brain tumors, and respiratory diseases such as COVID-19. The amount of people with this condition has gone way up since the COVID pandemic began. One of the symptoms of COVID is loss of taste and smell. With parosmia, it is common for these senses to go completely back to normal or almost back to normal sometime after the person no longer has COVID. Sometime after this, however, people will usually begin to experience food and other things smelling and tasting bad. The research question that I will be answering is, what is parosmia and what are the effects of it on people who have the disorder?
People have reported things such as meat, vegetables, alcohol, seasonings, perfume and cologne, toothpaste, and even water to taste and smell very repulsive. The cause of parosmia is damage to scent-detecting neurons, which are also known as the olfactory senses. Olfactory sensory neurons line the nose and tell the brain how to decipher chemical information associated with different smells. When these neurons are damaged, smells are interpreted differently by the brain. There are multiple different things that can cause damage to the olfactory sensory neurons. Brain injuries can cause damage to these neurons. This can either be from trauma or seizures. The duration and severity of parosmia usually depends on the injury. Smoking cigarettes and being exposed to chemicals can cause damage to the neurons over time. This eventually leads to the development of parosmia. Radiation and chemotherapy treatments can also cause parosmia. According to Healthline, a 2016 review found that 86% of cancer patients reported having changes in their smell while undergoing treatment. Neurological conditions such as Alzheimer's and Parkinson's can cause parosmia. One of the first symptoms of these diseases is actually loss of sense of smell. Bacterial or viral infections can also cause damage to the neurons. This is the most common in older adults but can happen to anyone. This is becoming way more prevalent due to COVID-19 causing anosmia, which is losing taste and smell. This can then develop into parosmia as the brain is trying to heal the olfactory sensory neurons. According to BBC News, about 65% of people that contract coronavirus get anosmia, or loss of taste and smell, as a symptom. About 10% of these people end up developing olfactory neuron dysfunction, therefore causing parosmia. This means that about 6.5% of people who have had COVID worldwide may be experiencing this long-lasting COVID symptom. It catches these people off guard because the disorder usually develops months after the person has already recovered and have gotten or almost gotten their senses of smell and taste back to normal. It is said that the disorder is not permanent and usually lasts anywhere from 3 to 6 months. However, some people have experienced it for over a year. Currently, there is no cure or medication to treat people with parosmia. This is due to the lack of research and knowledge about the disorder. For those who have parosmia due to cancer treatment, smoking, or environmental factors, the senses may go back to normal once the triggers are no longer present. There are some suggestions of different types of treatment for people to try. However, they may work for some people and not work for others.
Some supplements and vitamins are suggested when trying to improve distorted taste and smell from parosmia. Some of these include zinc, vitamin A, and alpha-lipoic acid. They are not proven to work, but some people with parosmia claim that their symptoms have lessened or gone away completely after taking these for multiple months.
Another thing that is highly suggested is to try something called smell training. Smell training is a process that includes smelling about 4 different strong scents every day and trying to remember what they smell like while doing this. It is commonly suggested to smell rose, clove, eucalyptus, and lemon essential oils. It works best if it is done twice a day regularly for multiple months. Parosmia is pretty much one of the last priorities when it comes to doing COVID research since it is not life-threatening. Because there is so little research and no answers as to how long it will last or if it will ever even go away, those that have the disorder may deal with major anxiety and or depression.
Having parosmia can deteriorate quality of life because it turns everyday things into major challenges. Those who struggle with the disorder feel helpless because there's nothing that they or anyone else can do to make their senses normal again.
It is also a very hard thing to describe to people who have never had to experience it, which can make people with parosmia feel very lonely. There is often a lack of empathy, understanding, and support for people with the disorder. People often act like it isn't that big of a deal, but having 2 of your 5 senses be completely distorted is a huge deal. Social interactions and events often become hard to endure because restaurants or any event with food will smell revolting.
When they were allowing to do outdoor dining, we went out. It was very overwhelming. All the smells were so strong but so bad, and I barely ate, and I just felt super disconnected. I remember coming home with my husband, and I just started like crying. I was just like, I can't live like this.
Parosmia can also affect people physically. Smells and tastes could be so bad that it makes people nauseous and can even make them sick. It's almost impossible for people to be in the same room as food or be around people who have just eaten or have perfume or cologne on. It can also take a toll on people's hygiene as toothpaste often tastes bad, and shampoo, conditioner, soap, and even water can smell bad. Weight changes and not getting enough nutrients are another concern for those who have parosmia. Because almost all foods are unbearable to eat, these people most likely do not get the nutrients that they need to be healthy. This can then cause them to feel achy, weak, and tired. Water can also smell and taste bad, so it may be difficult to drink the proper amount each day. People may lose weight due to not eating enough or gain weight from only eating bad foods since they are the only thing that tastes good.
Smell and taste are incredibly important and often taken for granted. These senses help you enjoy tastes of food and smells of different things. They also help you sense dangers such as smoke and expired foods. Parosmia distorts smells and tastes to the point of causing negative mental and physical effects. There is still so little research and information on this disorder, which is why it is important to raise awareness about parosmia. It is also important to show understanding and support to those that do have the disorder.